So dear students, we'll discuss a different topic today, that is in relation to burns. Burns is not uncommon, quite common. We come in our surgical practice, casualty, emergency, very regularly, the day-to-day affair, some severe burn, massive burns, more than 50% burns, deep burns, critically, this one, very, very high mortality ones, which is when it goes beyond 25% burns. So second degree burns, how exactly looks like? So look at that. See that here, burns area, typical second degree burns. You know that first degree, second degree, third degree, fourth degree. First degree is superficial burns, skin is involved, severe pain will be there, redness will be there. Second degree is blisters are there, skin peeling is there. Third degree is a deep skin involvement, insensitive, painless. Deep pain may be there, superficial pain is not there. But eschar is formed, thick armor coat like form, eschar forming. Fourth is muscle, joint, bone is not very, very deep it is. Another thing, partial thickness burn, full deep thickness burns, another classification. Then of course, Wallace's rule of line, where percentage wise you identify the percentage. It's very, very crucial to identify percentage to assess the and collect the and decide the fluid level requirement and plan the treatment strategy and eventually rehabilitation, sometimes reconstructive surgery is required, repeated dressings, all those things to plan. We should assess how much burns, percentage burns. It's a Wallace's rule of 9. So these are things which you have to remember. And second degree burn, chest, midless with thigh and left left. Wallace's rule of 9. This is the 9 front, 9 back, 9 legs, 9 upper limb, 9 head, 1% in the perineum, like that it is being classified. And so roughly along that, how much you classify, anything more than 50% is considered as 50%, beyond that is not considered. So it's very, very critical percentage it is. Anything more than 20-25% becomes very critical. Most of these patients requires hospitalization. Long-term hospitalization is important, cost is important. They have to go for repeated surgeries, repeated treatments, higher antibiotics, nutrition support, painkiller, everything. So clothing is removed, run the water in for 20 minutes, clean air and foreign body to be removed, sedate the patient, that's important. And maintain airway, ABCD, maintain airway, breathing, circulation. Fluid restriction is important. Parkland regime is the standard one currently. 4 ml percentage burns per kg body weight for 24 hours. First half is given in 12 hours, next half is next 12 hours. Then other regime is Muir and Berkeley. In ration it is percentage of body weight into percentage of burns into body weight by 2 is 1 ration. 3 ration in first 8 hours, 2 ration in the next 8 hours, 1 ration in the next 8 hours. That means you have to give rapid fluid. They need central vein. Otherwise they do 2-3 cannulas. They pain control, antibiotic, fluid management, mainly fluid management first thing. Initially always you have to crystalloid, then later you can switch over to the colloid. Eventually, based on the infection, if it occurs, antibiotic. But oxygenation, airway is very, very important. Breathing is important. Prevention of infection is important. Fluid management is, electrolyte management is very crucial. Maintaining the output is very important. You may have to pass catheter. If they find difficult to take food, then pass a nasogastric tube and feed him. Feeding him, nutrition is important. Everything is important in this patient because they lose protein, lose albumin, hemoglobin drop. Eventually, later hemolysis, nutrition will become malnourished, catabolic, and everything should be any stage of the day. Even after 20-25 days, you may lose the patient. Sepsis is common in such patients. Metabolic derangement is common. Psychological aspect also important. So everything has to be looked into to manage these patients. So fluid management is a standard is Parkland regime. Other is Muir and Berkeley regime. Later you have to manage the electrolyte and other things also. So tetanus toxoid, antibiotic, IV ranitidine is important to prevent the curling ulcers in the stomach. Rise to feeding, TPN, catheterization already told. Regular monitoring of the vitals, electrolyte, blood urea creatinine, culture, total count, platelet count. Local management by different reagents, silver sulfadiazine, local application. Once it granulates, we need to check engrafting. Usually mesher will use. Ideal to have a dermatome, electrical dermatome to take the graft in different areas. Sometimes staged grafting is required. Remember, complications, contracture, cosmetic problems, sepsis, renal failure, ARDS, acute gastric dilatation, curling ulcer, I already told. That's why IV ranitidine is given in this patient or IV pantoprazole. So burns is a main question for you. Oxy they will ask, PIVA they will ask, MCQs, so many MCQs are asked in burns. Remember, burns is a very important topic for UG students, PGs, and consultant and general surgeons. Remember, answer the MCQ students. Following is not true about electric burn. It's a deep burn. B, wound of entry and exits. Instant death due to ventricular fibrillation. Gas gangrene is rare in electric burn. So find out the answer and put in the comment box. I will get you back. So students, go through my SRB's clinical methods in surgery, which has got a video lectures of each topic. So many topics are covered. Every topic as far as CBM syllabus is covered. How to examine the patient. Swelling, ulcer, arterial disease, venous disease, thyroid, breast lump, mass abdomen, briefly orthopedic, every system, whatever your required thing, everything is covered. There is a video of how to examine of each topic, and principles of examination is good, and differential diagnosis in the table format is given, and briefly investigation. Suppose treatment is not a topic will be covered in a clinical method examination. Remember, and many photos of the most of the conditions with the illustration. Photos will tell the clear idea about for the students how exactly condition looks like. So covers everything with the beautiful photos, and it also gives the instruments, specimens, then operative surgery briefly. Everything is covered. Small images also it is covered. So it is more than sufficient for all undergraduate, postgraduates of any system to learn. Very basic required thing for the surgical field is clinical methods. So please go through that and purchase that and make use of it. My SRB manual of surgery is very popular. It covers theoretical aspect, everything, principles, treatment in detail, briefly technical aspect, and with the photos, illustrations, quotations, all topics with the specialty, urology, cardiothoracic, neurosurgery, and operative surgery instruments. Again, it is covered in this book also. Every quotations and used worldwide also, actually including our country, everywhere. And please, you can make use of it. My operative surgery book, SRB's operative surgery atlas, that is a 2-volume book, covers in detail operative technique of surgery, all surgery, small surgery, major surgery, everything, with total around more than 10,000 illustrations and photos. It gives very good principles and technical, step-by-step technical aspect. Very useful for postgraduates. But not much useful for undergraduate, but it's a postgraduate book and consultant book and learner after MS. It gives everything. You can, before going to surgery, you can always read this book. I will memorize your steps and do the surgery properly. Every topic, general surgery, gastroenterology is covered in detail, step-by-step with illustrations. And my SRB's atlas of tissue approach, small book atlas, 100 pages. How to do the suturing, tissue approximation, including laparoscope suturing with the video. It is covered. So any basic learners, suturing is very important surgical field as a skill actually. Dissection and suturing, so the two parts of the surgical skill. So that is also covered very well with videos. You can always go through that. And my website, please subscribe, all of you. Your daily lectures are there, live sessions are there. My digital lecture through JP Publishers, around 220-hour lectures. Entire thing as for CBM is covered with the examination part, with all topics of CBME, ulcer to operative surgery, instruments, specimens, examination, specialties, basic, everything is covered. You can always purchase for 1 year and have a clear idea about the surgical topics, understand very well, and helpful for your exam, NEET, MCQs. Also, it is there both in manual and my lectures. So students, I hope you have understood this lecture very well. Thank you very much.